to individuals in the community. So hopefully you'll recognize more of that as we move forward as well. So now I'll move it to Dr. Sullivan for more of an update, specific update on our vaccines.
Thank you as always, Gibby, and good morning, everyone. So again, as a brief update for vaccines for Mecklenburg County Public Health, as of today, we have administered over 95,000 first and second doses of the vaccine at our fixed sites, at our community events, and through our homebound vaccination program. And we've transferred more than 40,000 doses to enrolled providers throughout the community. Just as a quick highlight, we held an event last weekend at Camp North End where we vaccinated over 1,100 individuals. And the event really was a huge success due to the incredible planning by our staff, collaboration with a numerous number of community partners, and just nonstop positive energy and excitement, providing or receiving vaccines by all involved throughout the entire day. And I think that team effort was just a great example of the ongoing efforts to vaccinate our community as quickly and equitably as possible. As Gibby mentioned, we currently have a large supply of COVID vaccine available in the community, including both appointment-based and walk-in access at multiple facilities throughout the county. It's really good news, and given the significant vaccine availability and capacity at our current fixed sites through our numerous enrolled providers, public health going forward is really going to double down on our focus on our efforts on more coordination across providers and connecting with those that are hardest to reach populations. So we announced yesterday that we will stop providing schedule appointments at Bojangles at the end of April. We did open our last round of appointments at starmed.care this morning for first doses through April 30th. Those appointments can also be accessed through our hotline, 980-314-9400. And we still will be offering walk-in first dose appointments and all second dose appointments for those who received their first doses through April 30th at Bojangles through May 20th. And we're really proud of the efforts, number of vaccines, and impact that Bojangles has had as part of the vaccine response, but are also confident that there's now sufficient access at our larger fixed clinical sites in the county. And again, public health efforts can focus even more now on targeted vaccination and outreach in the community. We still have our Medic site on Wilkinson Boulevard open on Monday, Wednesdays, and Fridays, and some Saturdays for both appointment-based and walk-in vaccines. We also continue to closely collaborate with StarMed, with Novant, with Atrium, and other enrolled providers to ensure sufficient ongoing vaccine availability at other sites. And we are currently also conducting direct outreach to potential vaccine providers who have not yet enrolled to be able to provide COVID vaccine yet, in order to engage even more providers throughout the county. And just a couple other quick announcements. In accordance with our vaccine equity plan, we have been working to update our COVID-19 website to reflect available vaccine opportunities, and our hotline staff continue to assist residents with appointment and walk-in opportunities throughout the county. We also continue to host multiple community-based clinics at locations throughout the county, which includes this week partnership with the LGBTQ Chamber of Commerce tomorrow, the Calvary Christian Church, and the Holy Trinity Ethiopian Orthodox Church on Saturday, and another event at the Southview Recreation Center next Monday. And all of these events will offer both appointments and walk-in. And then finally, as Gibby said, in addition, part of our ongoing efforts to reach individuals who have not yet been vaccinated, we are expanding the COVID ambassadors' role in vaccine outreach, launching a partnership with Action NC for grassroots canvassing and door knocking, and increasing our efforts to partner with community-based organizations, home health agencies, and providers to identify and reach homebound individuals who have not yet submitted a request for a vaccine. And with that, I will stop and open for questions.
Thank you, Dr. Sullivan. First question today is Brett Jensen, WBT Radio.
Hey guys, thanks for doing this. Curious, Gibby, you said something last night at the county commissioners meeting that, and you reiterated it a little bit today, that seems to be a little fascinating about the lack of urgency. And, you know, I went out to Bojangles yesterday for about an hour and a half just to talk to people as they were leaving. And it also seems like, talked to some of the employees there, they said only about 10%, it was a rough estimation, were actual walk-ins. Everyone else pretty much had an appointment. So the lack of urgency, is that more of the younger community that you're seeing it from, or just is that across all age spectrums? And is one of the reasons that you're deciding, I guess, maybe to shut down the Bojangles in May is just because, like I said, only 10% of them are maybe walk-ins right now?
So that's a long question. Let me see if I can address.
Sorry about that.
That's okay. No, let me see if I can address everything. If I missed something, let me know, Brett. So what I will say is that we are looking at closing down Bojangles because there are a number of other sites, large sites in our community now that are readily accessible to individuals, and it frees us up to do more in the community, small events being more accessible to individuals, and really being able to target the efforts more to those populations that we're seeing that we're not getting vaccinated as quickly. So that's the main reason for Bojangles. It's not that there's going to be less availability of vaccine. It's just that site is not necessary anymore. That's basically the reason for closing it. What we're seeing, especially with our younger population, is not necessarily everybody saying, I don't want the vaccine. We have some people who are on the fence for the vaccine. But what we're finding is that if in some situations, if you're readily available to them in an easy access situation where they don't have to make an appointment, they don't have to take time off of work and drive over, and all of that sort of stuff, and they have the flexibility of just saying, oh, I'm here and the vaccine is here, I'll get it, there's a greater chance that we're going to get, especially some of our younger population, vaccinated, because they're just not necessarily taking the time and the energy that it takes to get the vaccine. So they may eventually get it, but right now it's just not convenient. So we want to make it as convenient as possible. I will say that what we're seeing in Mecklenburg County is a large percentage of our 65 and plus are vaccinated already, which is great news. Those were the folks that we were most worried about in the beginning, the highest risk for severe illness and death and hospitalizations. And a large number of those are vaccinated at this point. So again, starting to shift our focus a little bit to make sure that we are being equitable. So we do know that our African-American population and our Hispanic population has lagged behind a little bit in terms of the percentage of that population being vaccinated. So we want to continue to make ourselves available to those populations. We want to make sure that our homebound folks are getting vaccinated. But again, as hopefully Pfizer is approved for 12 to 15-year-olds, we want to make sure that we're able to reach that population as well. So it frees us up to do more of those specific types of events in our community and to leverage what some of our other partners are doing. So that's sort of where we are right now. We will learn more as we move forward. It hasn't been a long time that Group 5 has been eligible, so we're still learning about what some of the constraints are with vaccines and what the issues of hesitancy are there, and we'll make adjustments as we learn.
Nice job. You covered it all.
Next question is Paige Hopkins, Axios, Charlotte.
Hey there, thanks for taking my question. I'm wondering about where the county is in the planning process for partnering with breweries for vaccination events, and also at events like that, has the pause in Johnson & Johnson caused any concern for setting up second doses, making sure people are fully vaccinated, not just getting that first dose? Thanks.
Yep, those are both good questions. I think taking the second part first, definitely, like we've talked about multiple times, the Johnson & Johnson vaccine does offer a significant benefit at being a single dose vaccine. And as Gibby said, we are anxiously awaiting the Advisory Committee on Immunization Practice meeting this week on Friday for an update on their intensive clinical review and recommendations going forward about using that vaccine. And yes, we have had to modify some plans, including at the Camp North End event this past weekend. We were intending to use Johnson & Johnson, so we used Pfizer instead, and we'll be going back in 3 weeks, which does, though, take away, meaning additional time spent there rather than doing kind of another clinic somewhere else, although we are excited and we'll be offering first dose appointments there as well. We did hear from multiple individuals at Camp North End that they came in and would have received Johnson & Johnson, but declined to use Pfizer to get Pfizer because of the 2-dose requirement. And so again, we are waiting to see which vaccines are available. In terms of your first part of your question, we have already had some conversations with breweries, with other organizations, businesses, trying to be really kind of innovative and creative in where we go. And we'll continue to do that going forward and expect to have some events at some of those locations in the future.
Next question is Allison Kuznets, Charlotte Observer.
Dr. Sullivan, it's Allison from the Charlotte Observer. Could you talk about, as you're seeing more no-shows and these walk-in appointments, how many doses are being wasted right now? And what kind of logistical planning do you have right now to ensure that you don't open a vial too late in the day and nobody is showing up?
Yeah, I think it's a great question. You know, I know we've talked about the logistics and challenges that have been present since the first day with these vaccines, given the multi-dose vials and stringent storage and handling requirements, and definitely allowing walk-ins increases the logistical challenges, but we recognize the need for it in order to better serve our community. And so it's something that we plan very carefully for. We think very carefully, especially for our community-based events. How many vaccines are we going to bring? And we have very specific coolers that we're monitoring temperatures every 30 minutes to an hour to make sure that they are appropriate, and being very mindful around when we're pulling up doses, especially towards the end of the day. I think the other thing that we're recognizing is more and more people get vaccinated, kind of finding those extra arms at the end of the day is more challenging just because, again, you have a higher percentage vaccinated. I will say still, we have not had to waste a dose for that reason. We have always managed to be incredibly careful and find arms, but it is something that is becoming an increasing challenge. And I know, you know, they're starting to have conversations kind of on the federal level with the companies to think about, is there possibilities around reducing the number of doses, making single dose vaccines available or single dose vials, just because especially as we think about incorporating the vaccination more and more into primary care settings, into other clinical settings, that's an issue that's going to come up again and again.
Next question is Joe Bruno, WSOC TV.
Hey, y'all. I'm wondering, so you mentioned that our metrics are increasing, but I'm wondering what our ICU stats are and whether they are increasing as well, or if we're actually seeing lower levels of people in the ICU who have COVID now. And if so, if that's a good thing, if, you know, even if numbers are increasing, as long as the ICU isn't increasing, then we're in fairly good shape. The other question is, you mentioned about 34 or 30, lower 30 are have received a vaccine so far in the total population in Mecklenburg County. I'm wondering what our number is for the eligible population, and if that is more important of a number right now than total population, considering there are so many people who aren't able to receive it because they don't meet the age requirement.
Those are really good questions. Again, going to the second question first. Yeah, we've been looking at that, and we have just recently gotten some additional information from the state on the people that are being vaccinated. The data is always not readily available to us, and it is more important to look at the percentage of individuals that are eligible for vaccination, obviously. But at the same time, the numbers that I was talking about was the 20 to 35 to 40 age range, and those are all eligible. And they're not being vaccinated as quickly as we would like them to be vaccinated. So we need to stay focused on that and continue to make vaccine available to that population and encourage them to be vaccinated. So we'll continue that work as we move forward. Now, Joe, remind me of the first part of your question.
Sure, and just a quick follow-up on that, but that 30% number, though, is total population, though, correct? So we could be having 50% of people eligible already receive at least one dose, possibly. We just don't know what that number is. And the first question was, what does our ICU look like? Are those numbers spiking as well?
Yeah, so our what we heard from our hospital partners early this week is that they have seen some increases in hospitalizations, but not an increase in the number of people with COVID in their ICUs. That number is fairly stable and definitely is not what it was back in January. So at this point in time, they're feeling like they have a good handle on the number that are in the hospital. They're able to serve who needs the care and have the ability to continue to expand access for if that need arises. So right now they feel like they're in good shape with the numbers that we're seeing, even though they are crawling up slowly. But ICU beds have not increased. It's just the number of people in the hospital setting.
And if I could just make a couple of comments about your first question, which I think is a good one. So you correct, 34% of overall population. And we know right now individuals age 16 and older are eligible to receive the vaccine. And so there is, yes, a percentage of the population that right now can't receive the vaccine. So that percent of eligible population would be higher. But I think two important points. The first is, as Gibby mentioned, we are very optimistic that 12 to 15-year-olds will be eligible in the near future, and know there's ongoing clinical trials about for ages even younger than that. And so that eligible population will continue to expand. So the more we can get vaccinated now for those 16 and older, that'll make that the number remaining less. I think the second thing is what the 34% though tells us is also who has that level of protection.
Yeah.
So for those 16 and younger, it's true they're not eligible to receive the vaccine, but they also don't have the protection from it. And so we really need to focus on getting at that number as high as possible so that we can get some level of community immunity and prevent spread.
Absolutely. All of those individuals from birth to 16 at this point in time are not eligible, don't have protection, but are being exposed every day to individuals in our community who are not vaccinated. So I agree perfectly with Dr. Sullivan and her points there.
Next question is Hunter Science, WCNC.
Hey there, Gibby. A quick change of topic here. I saw a tweet recently about another homeless encampment on NCDOT property near the music factory being told by the health department to vacate within 7 days. Can you confirm that and give some information? If so, how many people are we talking about moving? And is the county providing any hotel space like they did for the Tent City residents?
Sure, Hunter. The reality is we have not provided any directive or any order for that site. We have had conversations with DOT as we continue to look at encampments and make sure that we're not seeing additional issues like we did at the North End encampment. Our staff continue to monitor those sites. We have seen a little bit of rodent involvement there, and we were seeing that site grow. So we have had conversations with DOT about this, but the responsibility and the authority to do anything about that site belongs to the property owner, and that's DOT at this point. So what we did was facilitate some conversations with them and with Roof Above, especially their outreach team about, what needs to happen at that site. DOT, I think, has had some plans to do some fencing down there because they're getting ready over the next year to do some repair works on that bridge, and they don't need people under that bridge while they're doing that. So, and the other thing is that were wanting to make sure that there was sufficient space in whatever setting for these individuals if they did ask them to leave. So basically what we've done is we've worked with those outreach folks. They have worked with DOT. They've had conversations with all of the folks that are at that site. And I think the last I heard, there were only maybe 10 people still at that site. All of them have been offered shelter space. There is shelter space open and available to them. We are not opening any more hotels. The county has no specific role here either. So right now, DOT is working with the outreach individuals as well as with CMPD to try to clean up that site. That's what they want to do, is clean it up, and it's hard to do with people living on it. So they're moving forward with that. We, again, have no orders or no directives that we have applied to that situation. We're just trying to be proactive and working with the owners of that site.
But to confirm, NCDOT is moving our homeless neighbors off of their own property. And second follow-up, what's the difference between you putting a directive on NCDOT property from the part of the Tent City encampment versus this? Has it not met that threshold for you to put a directive?
So Yes, we've been working with them, and it's my understanding that they were going to move ahead with fencing that property, and obviously they can't do that with people living on it. So it was my understanding that they were working with outreach, the homeless outreach folks from Roof Above, to find other particular settings for these individuals. I don't know what the timeline is for that. I've not been involved in the most recent conversations around that. This particular situation, it's nothing like what we had with the North End encampment. That encampment was growing significantly, and was really sort of out of control in terms of safety issues and public health issues. That's why we issued the order, the abatement order for that site. This site is nothing like that. The only reason we're involved is that my staff are continuing to assess sites across the city and the county to make sure that we're not getting to the point that we did with the North End encampment, and allowing us to have those conversations early on with the owners of those properties, which is what we did with DOT in this particular situation. So there was nothing going on at that site at this point in time that would cause me to need to issue an order. And at this point in time, public health has no authority or no reason to implement public health authority on that site based on what we've seen.
Gibby.
You're welcome.
Next question is Robin Kennedy, Fox 46.
Hi there. Thanks for taking my questions. I did just want to follow up with Joe's question. Do we have a number? Well, I've got two questions. One is following up with him. Do we have a number on what percentage of the population in Mecklenburg County is 16 and older? And I know we've talked about this, Gibby, with the count, with the state count and the Mecklenburg County count, not including the pharmacy, the federal pharmacy program through CVS and Walgreens. Is that still the case, or have you guys been able to sync that up? And if not, is that in the works? I'm imagining that this could make a big difference in the vaccine count.
So great questions, Robin. The first one is, we could pull the latest statistics on individuals 16 and over in Mecklenburg County. I don't have that data off the top of my head, but we'll be happy to get that for you if you're interested in that. And the second one is we are. I lost my train of thought here. Y'all throw me with
federal pharmacy
yes,
program included in the count.
Yes, I get focused on one thing and have trouble making that switch to another. Actually, now those numbers are included. The state has reconciled that, and that did make a difference. At one point, we were well down below 20% with those fully vaccinated, and now, as we mentioned, we're close to 22% fully vaccinated. So that's included in that count at this point. When you go to the state site, you can pull it up just for those folks who are implementing the vaccine from the state, as well as all providers, and the all providers are in the numbers that I presented to you a little bit earlier. So that gives us a more complete picture.
Next question is Vanessa Rufus, WCNC.
Good afternoon, everyone. Hope everyone on the call is doing well. I had a couple of questions, just trying to get an idea, first of all, of the difference between what the supply and the demand is. So for example, we know during the height of the demand, we were seeing essentially maxing out the supply 100%. What percentage of your new shipments coming in are you actually using? So, just to get an idea of what the difference is now. And then my second question is, if you could just kind of rate your concern level with the rises. Obviously, we're not seeing big surges like we were seeing prior with those, holiday, kind of around the holidays, and then over the summer. At what point will we start to go, okay, we're not keeping up with our vaccinations with the amount that people are moving around at this time?
Yeah, so I'll start with the first question. So, I think, as you said, I think in positive news, we just have a lot more vaccine that is available on the federal, state, and county level. And I think that's really exciting. We know that we have a lot of people who are already vaccinated, but still a significant ways to go. And again, though, because of that increasing supply, and then as Gibby referenced, some impact of decreased urgency, are starting to see a little bit of that imbalance. What I will say is still up until, last week, we were still getting out pretty much every single dose that we were given. Definitely, I think the last week there was an impact felt from the Johnson & Johnson a pause because we still have Johnson & Johnson that we are storing carefully and monitoring that it doesn't expire until June. And so we hope to be using that. And then kind of working through a couple of other events where we had different number of people that came than we anticipated, but we still definitely had been getting out the overwhelming majority of the vaccine. Actually, this week, the state, though, has switched their allocation system and has made it a request-based system rather than an allocation system. And so that allows us actually to work really closely with our enrolled providers as well, because a lot of the work that we were doing was facilitating transfers based on the allocation that the state was giving us. And so working with them so they can directly request vaccine, we can determine how much vaccine we need to request and really make that balance as well. The second question, I think level of concern. I mean, I think as public health professionals, we have been, in a heightened state of concern for a while. Obviously, that level has varied over the past year and is lower than it was 2 months ago, knowing that our numbers are lower and we have safe and effective vaccines and a large percentage of people vaccinated, but it still is, it's still higher than we want it to be. We still know that there are still a significant number of people who are unprotected. We still see way too many cases every day that we need to see. We know how to prevent them, and we need everybody to have some level of concern and understanding that COVID is still in our community, and we all need to be vaccinated. We all need to be wearing our masks. We need to be socially distancing, and we still need to do it to get those numbers further down.
Next question, Christy O'Connor, WBTV.
Hi, Gibby. Hi, Dr. Sullivan. As we are starting to see the vaccination rates slow or plateau, do you have any concern that we won't reach herd immunity? And if so, will all of the vaccinations that have been administered be for nothing?
Number one, there's no way I can believe that the vaccinations that we've done up to this point have been for nothing. If nothing else, those individuals who have been vaccinated are less likely to become seriously ill, and if they become infected, less likely to be hospitalized or die from COVID. So there's success there in and of itself. And we continue to be cautiously optimistic. We want to be reasonable in our thinking about how many we can get vaccinated, but at the same time, I can tell you that our staff are pushing as hard as possible every day to get vaccine into arms, as are our other vaccination partners, especially our healthcare systems. So there is a major effort still, just because we've got a lot more vaccine and there seems to be a little less urgency around this. It hasn't slowed us down any. So we are hoping to continue to move through the summer with vaccinations and making sure that people have access and doing everything we can to help people understand why it is important to get vaccinated and the benefits of that to themselves, to the people they love, the people they're around, and to their entire community.
Next question is Hannah Smoot, Charlotte Observer.
Hi, Gibby. Can you talk a little bit about the vaccine doses available today at the Billingsley Road location? How many doses are available? Are they expiring today? Are they at risk of being thrown out if enough people don't go get them today?
They're not at risk of, no, they will not expire today. We're not at risk of losing vaccine at this point. What we have, though, are additional slots that did not get filled with appointments. So we have vaccine available for those who would like to walk in. And would encourage people to stop by. It's a very quick, easy process. We've got very cheerful staff who give great shots. You don't even feel it. So those folks who are scared of needles, please come on down and we just know that we've got vaccine and we want to get it in all the arms that we can. So, but again, if vaccine that we don't use today will be available tomorrow, so we are not at risk of losing any of that vaccine.
Yeah, and I think just to clarify, also one of the things that we watch, no vaccine has long expiration dates, but once you take it out of the freezer, Pfizer, then you have a certain amount of time to use it. And we are, yes, incredibly careful about that. We do not waste vaccine, but as Gibby said, that we are not worried about wasting vaccine today, and we'll continue to have vaccine available.
Next question, go back to Joe Bruno, WSOC TV.
So we had heard from Dr. Washington a month ago or a couple meetings ago that 65, 70% is the goal, a moving goal for herd immunity. And when we reference 65, 70% needed, are you going off the total population number or the eligible adults number?
In general, at the national level, state level, we've been talking about 65 to 70% for herd immunity of the entire community, looking at everyone, not just those who are eligible. I do believe that we're probably going to see a specific target put out by the state sometime soon. And I would imagine that they'll put that rate out based on eligible populations. But up to this point, the 65 to 70% has been focused on entire population.
Okay, we're going to go back to Brett Jensen.
This is going to be sort of like Groundhog's Day and follow up on Joe's and Robin's question about the percentages. Well, you were talking about the how you now have access to the pharmacies and all their numbers, and that increased it to about 22%. But wouldn't that have also increased it all over all the other counties in North Carolina, so that we would still basically be lagging behind the rest of the state? Does that seem an accurate statement? And is that an accurate statement?
If you look at the percentages of other counties in a number of situations, yes, we are behind, quote unquote, behind where they have been. We've made the point before, and I'll reiterate it again, especially in the early phases when vaccine was not readily available. We vaccinated a lot of individuals who do not live in Mecklenburg County. Many of those work in Mecklenburg County, shop in Mecklenburg County, come into Mecklenburg County for any number of reasons. So obviously we wanted them vaccinated as well because they bring virus into our county when they come in. So we were vaccinating them, and those numbers do not count into our overall percentage. So in some ways, because we were a larger county, we had some big events going on, and vaccine was more available here than it was in other counties, and as well as in South Carolina. We probably did more of that than a Wake or a Durham that sits in the middle of the state. And so we are not surprised that our percentages are behind some of those counties. We are slowly catching up, and we are, again, have not wasted any vaccine at this point. So we'll just continue to work on getting those percentages up for Mecklenburg, and hopefully we'll at least catch, if not surpass, some of those other counties at some point with all the hard work that staff are doing.
I was going to say a quick follow-up. I'm sorry. I was, like I said, I was out there yesterday by Bojangles, and I ran into 4 people that were from Mooresville, that live in Mooresville. Yeah. Is that something that you guys are still seeing, or has that initial crush left, or are you still seeing a lot of people come in from other counties? Like I said, I had 4 people yesterday in an hour and a half that were from Mooresville.
Yeah. Yeah, we are still seeing folks from other areas because of I've got to say, with some of the efforts that have been implemented in this community, whether it's through the health department, the healthcare systems, or some of our other vaccination partners, sometimes vaccine is more available here, more easily accessible than it is in other counties surrounding us. So we still see some of that. I don't think we see it at the level that we did at the beginning and the first month or two of the vaccinations. But yes, we continue to see that. And as I said, those folks may work here, they may shop here, they may come in for doctor's appointments. They're in our community. And if they are not vaccinated, they're a threat to our community, just like folks in our community who aren't vaccinated are a threat. So we want them vaccinated, and we'll continue to make that available to them.
Quick question, Gibby, and I'm sorry for it being quite bizarre ahead of time, but when we talk about possibly going to some of these breweries to make the vaccine more accessible to different groups, I'm just wondering, what does that process look like, especially if it's like a 2-shot vaccine, or will it only be the J&J vaccine when and if it becomes available again, in order to like prove when you come back for a second one, how is that going to work? Do you just go to any other brewery or pop-up clinic? And then also, what does it all entail in processing if these people are actually coherent enough to say, yes, I want to get the vaccine or not at a brewery?
Yeah, that's good questions, Hunter. Number one, we have sufficient vaccine at this point that people are not necessarily required to come back to the same location for their second dose. They just need to access it. So if they went to a brewery and then they've got another opportunity somewhere else for that second dose, they just need to make sure they're getting the right vaccine. You don't want one Moderna and one Pfizer. You need to get 2 of the same. And we will be careful about how we schedule events at breweries and places like that. We are not going to go out at 11 o'clock at night when people have been there since 5 o'clock and try to convince them to be vaccinated. We'll be very careful in that process and working through that. The main thing is bringing it to places where it's easily and readily available and accessible to individuals that are quite often show up at those sorts of places and might not show up at other places where we have vaccine available. So we'll be careful about that process. And I don't know, Dr. Sullivan may have a little more additional information she'd like to provide on that.
No, I think that is a really great question. I think first to say that when we do community events, regardless of where they are, and if we use a 2-dose vaccine, we always plan to go back the second time at the appropriate interval, whether it's 3 weeks or 4 weeks, depending on what we're using. But as Gibby said, and I think this has changed over the last couple of weeks, and important information for our community to know that given the changing landscape of vaccine supply, if somebody got a first dose of vaccine at one event, they do not need to go back to that event. There's now kind of walk-in availability at multiple locations throughout the county for both first and second dose appointments. We do highly recommend that everybody keep their card that they get as proof of vaccination for their first dose and bring it or a picture of it to their second dose or to get their second dose, because a provider does want to verify A, that it's the same type of vaccine as Gibby mentioned, and B, that the appropriate time interval has passed to get that second dose. And so that is important that they do bring that. I think the second question that you bring up is a great question, and it comes up every time we administer a vaccine or any medical service. Capacity to consent is something that is always on our radar, regardless of where we're administering the vaccine, but would be heightened radar, right, if we are administering a vaccine in a location where capacity to consent may be maybe more likely to be there. So we always assess. Our goal is to make sure people do informed consent. They understand the benefits of what they're receiving. They understand the risks and can have that capacity to consent. And that is the responsibility of the clinical provider to always assess before providing a vaccine.
So to confirm, Dr. Sullivan, is there a mandated safeguard? I mean, I don't know of a database showing, let's say, if you get the Pfizer vaccine or if you get both doses of a specific vaccine, but then you're out with your friends and you go and get a third one. I mean, is there a safeguard to protect that, or is it on the individual themselves?
I think it's a combination of the individual themselves. So again, recognizing when they're coming back that they understand that they need their second dose. And if they already got 2 doses, to understand that they don't need a third dose, but also again, on the provider. So we had a few people, for example, at the Camp North End event that I saw that had walked in for their second dose. And so we talked them through, confirmed what was the date of your first dose. I looked at proof of the card. One of them had the card, one of them had a picture, one of them we were able to call someone else to get that information. So I think it's a combination of both to really confirm that. Now, if we do have someone that comes in and says they've never received a vaccine before and they're here to get a vaccine, we don't, and really they've already received 2 doses. We don't know that information, and we really have to go on with the information they're providing us, but I don't think that happens very often.
Thank you.
Floor is now open for follow-up questions. Go ahead.
I was just going to say, we're finding more people who don't want to get stuck more than they have to, than people who might come in for a third dose. Sorry, Allison.
Hi, it's Vanessa with WCNC. Oh, sorry.
I saw Allison's hand up. Go ahead.
Oh, I'm sorry.
No, go ahead, Vanessa.
Okay, I just wanted to make sure that I'm appropriately understanding what the supply and demand relationship is. Is it a plateau? Like, are you legitimately vaccinating fewer people? Because I feel like we keep using the terminology like demand is decreasing or something like that. You're not actually vaccinating fewer people than before. You just aren't seeing the huge surge, correct?
Exactly. We are a couple of things. Number one, we're getting more vaccine. We have been getting more vaccine, obviously, than we had early on. So the plateau is more of when we open up appointments this morning for Bojangles, a month ago, those appointments would have been gone in a couple of hours. It takes longer to fill those appointments, and some of them don't get filled. And so we have walk-in capabilities at our sites. So it's not that we're vaccinating fewer people. It's just that we have more vaccine available to us, and the demand has not kept up with that supply. So again, as we work through this, we'll do our best to make it more accessible out in the community. I think ease of access is going to be a huge part of how successful we are moving forward.
Maybe a question on variants. As you're talking about increasing evidence of those variants, are you referring to just more genetic sequencing of the variants? How many testing are being sequenced? And also, what is the prevalence? How many cases of the UK variant, South African variant are we seeing in Mecklenburg right now?
That's a great question, Allison. Unfortunately, we are not seeing sequencing of all positive test results in Mecklenburg County at this point. We're doing some work with UNC Charlotte. They have some capacity to do sequencing. We're having conversations about what sequencing could be done with positive test results from the schools. We're having a number of conversations around this. So we are getting bits and pieces of information around sequencing. The state is not doing as much as we thought they may do about this. So that's not providing that information as well. So what we get are little bits and pieces of information, but what we are seeing in some settings where sequencing is happening is an increase, especially, like I said, in the UK variant, in the number of positives that are being recognized. So we're watching that as closely as we can, but again, it all depends on how much sequencing is available to us of the positives that we have in our county.
Do you know demographics of the people who are testing positive for the UK variant, what their age range is?
We do not have that information at this point. Would like to have it, but don't.
Next question, please. Last call for questions. All right. Thank you, Dr. Sullivan. Thank you, Director Harris. And we'd also like to thank today's American Sign Language interpreter, Richard Hafner. Everybody have a great afternoon.
Thanks, everyone.
Thank you.
That's a very interesting one, because sometimes when I hear people say economic impact analysis, what I think they're saying, and correct me if I'm wrong here, is market demand.